Hello, and welcome back to Ask Your Pain Doc. In this channel, we talk about traditional and alternative treatments for pain. Today, we're going to talk about something really exciting. I'm pretty sure you all want to hear it. All this new data about this new medication that approved for depression. I don't know if you guess what we're going to talk about today. Yes, we're going to talk about ketamine. Make sure you subscribe to my channel, turn on notification. Let's do it. Ketamine is an anesthetic medication that is used medically for induction and also maintenance of anesthesia. It is also used as a drug that can be used to treat pain and also depression. Ketamine is a synthetic drug, so you cannot find that medication in nature. Ketamine was first used and produced in 1962 and approved for use in the United States in 1970. It's been regularly used in a veterinary medicine and was extensively used for surgical anesthesia in Vietnam War.
Ketamine was first synthesized in 1962 by Calvin L. Stevens, a professor of chemistry at Wayne State University and a Parke-Davis consultant. It was known by the developmental code name CI 581. After promising preclinical research in animals, ketamine was tested in human prisoners in 1964. These investigations demonstrated ketamine's short duration of action and reduced behavioral toxicity, made it a favorable choice over phencyclidine, PCP, as an anesthetic. The researchers wanted to call the state of ketamine anesthesia dreaming, but Parke-Davis did not approve of the name. Hearing about this problem and about the disconnected appearance of treated people, Mrs. Edward F. Domino, the wife of one of the pharmacologists working on ketamine, suggested dissociative anesthesia. Following FDA approval in 1970, ketamine anesthesia was first given to American soldiers during the Vietnam War. The discovery of the antidepressive action of ketamine in 2000 has been described as the single most important advance in the treatment of depression in more than 50 years. It has sparked interest in NMDA receptor antagonists for depression and has shifted the direction of antidepressant research and development.
The use of ketamine in anesthesia reflects its characteristic. It is a drug of choice for short-term procedures that we do not need muscle relaxation. Ketamine is frequently used in severely injured people or in trauma field and appears to be pretty safe in this group. It has been widely used in emergency room, in war zones. It is the drug of choice for people in traumatic shock because ketamine can increase the blood pressure, so it can partially treat the low blood pressure that can happen at trauma scene. However, patients with traumatic brain injury should not receive ketamine because it can worsen the intracranial or inside the head bleeding. Ketamine infusion are usually used for acute pain treatments in emergency department and in the perioperative period in individual with refractory pain. The dose of ketamine usually way lower than the dose of ketamine that we use during general anesthesia, and usually adding ketamine to morphine or other type of pain medicine, it usually reduce the amount of morphine or other opioid pain medications. Ketamine is also reduce the amount of nausea and vomiting after surgery is likely to be the most beneficial for surgical patients with severe post-op pain that is expected and is for usually patients who are very tolerant to opioid pain medication. For chronic pain, ketamine is used as an intravenous analgesic, particularly if the pain is neuropathic or nerve-related. It has the added benefit of counteracting spinal sensitization, or what we call it the wind-up phenomenon that happens in brain with chronic patients. In multiple clinical trials, ketamine infusion delivered short-term pain relief in neuropathic pain and also after fibromyalgia and what we call the complex regional pain syndrome, or CRPS. However, there was a study in 2018 that showed there is really weak evidence in favor of ketamine use in spinal injury. There's also moderate evidence in use of ketamine for CRPS, and there is still controversial evidence that ketamine can help fibromyalgia and cancer pain. In my opinion, ketamine could also help with the depression that related to any of these conditions. Ketamine is a robust and rapid-acting antidepressant. Although its effect is transient, intravenous ketamine infusion in treatments of resistant depression that very difficult to treat with traditional antidepressant can result in improved in mood within 4 hours of reaching the peak ketamine, and also can last up to 24 hours. A single dose of intravenous ketamine has been shown in a response rate greater than 60% after 4 hours of ketamine infusion. And it can also be more than 40% beneficial after 7 days. FDA recently published some studies that ketamine can be beneficial in treatments of refractory depression. And now we see a lot of more studies hopefully coming soon that shows the long-term benefit of ketamine for depression. Most people who were able to remember their dreams during ketamine anesthesia reports near-death experience, when the widest possible definition of near-death experience is used. Ketamine can reproduce that feature that commonly have been associated with near-death experience. In 2019, there was a large-scale study found that written reports of ketamine experience has a high degree of similarity to written reports of near-death experience in comparison to other written reports of drug experiences. Ketamine can also be used to treat status epilepticus, or very refractory seizure that does not respond to standard treatments, but only case studied, but there is no really a big randomized control trial studies to see this efficacy.
Ketamine abuse. Ketamine, also referred to as Special K, Kit Kat, Cat Valium, Dorothy, or Vitamin K, is an anesthetic for animals that is abused as a recreational drug. It is especially popular in the club scene among young adults. The recreational use of ketamine results in a number of central nervous system effects such as floating sensations, alterations in body image and mood, drowsiness, vivid dreams, delirium, and hallucinations. Individuals who abuse ketamine have been reported to binge on ketamine, which is a behavior frequently seen in cocaine addicts. If the ketamine user is mixing ketamine with other drugs or alcohol, a ketamine overdose may result with only a very small amount of ketamine. Frequent users of ketamine have exhibited disturbances in verbal memory. These individuals may experience difficulty in remembering conversations and people's names. The usual illicit dose of ketamine ranges from 50 mg to 100 mg. Acute toxic effects of ketamine abuse include tachycardia, cognitive dysfunction, abdominal pain, muscle rigidity, hypertension, and raised intracranial pressure, with death being the end result. At times, cholestasis has also been linked to chronic ketamine abuse. Cholestasis is a reduction or stoppage of bile flow from the liver to the duodenum. Ketamine withdrawal symptoms are usually not as severe as some other drugs, being that the symptoms are psychological. However, these symptoms are usually accompanied by strong cravings. Ketamine can cause amnesia, which may lead to overdose deaths, as abusers of ketamine may not be aware of the dose of the drug which they have taken. There are many drugs which are abused for a wide variety of reasons. The common denominator to understanding all forms of abuse is a knowledge of addiction. Ketamine is a drug which has been abused through the years by many individuals due to its psychological effects. Unfortunately, it has also been used on unwitting victims as a date rape drug. The ketamine come down. Even after using ketamine for a brief period of time, there is a high probability that a user will experience what is called a come down. The come down is a drug-induced equivalent to a hangover and can be intense and dangerous. Since ketamine is designed as a sedative, it is very likely for users to experience intense confusion and delirium when the initial peak effects or high dissipates. These individuals may also experience muscle weakness, anxiety, and feelings of hopelessness and helplessness. They may also experience numbness, impaired vision, and severe confusion that often leads to aggressive behavior, amnesia, and delirium. These symptoms are more likely to occur at higher doses of ketamine, often via repeated use over many hours, or when combining ketamine with alcohol or other drugs.
Ketamine is a great medication, especially for patients with severe refractory depression and patients with severe pain that do not respond to regular pain medication. I usually use that ketamine for these two types of patients. I hope you've learned something good today, and please make sure you send me your comments and feedback. Please support my channel by hitting the subscribe button. Make sure you turn on notifications so you get notified about our new videos. I love you all. Make sure you stay tuned, and I will see you all soon with our next video. Have a great day.